Cloudcast Media. Drew Schlosberg Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
I'm Drew Schlosberg of Cloudcast Media, and we are so thrilled to have in the studio with us our friends from TrueCare. We got Michelle Gonzalez, the president and CEO, joined by her colleague, Dr. Myriad Russell, chief medical officer and chief operations officer as well. And before we get into the interview, it is my honor to have as a co-host, he'll be asking a few questions here and there, my longtime friend, Sal Giametta. He's on the USS Midway board and a longtime community leader, and honored to call him. How long have we been friends?
Several decades, Drew.
We're going to leave it at several decades, and that's it. And of course, Sal has just been doing wonderful things in our community for many, many years. But we'll start with you, Michelle. Talk about TrueCare. What is it? How long have you been involved, and what's the mission?
Well, good afternoon. It's great to be here. TrueCare is a federally qualified health center, also known as a community health center. We take great pride in providing comprehensive, quality, highly compassionate, comprehensive medical and dental services to our communities, primarily in North County, and we also have a location in Riverside. We've been in business for over 50 years and have a workforce of more than 700 individuals who we lovingly refer to as true heroes. And we have an outstanding mission that has certainly lasted the test of time, which is really to assure that we can improve the health status of our diverse communities by providing comprehensive, affordable, quality healthcare to everyone who walks through our doors.
So how does that work? Is somebody up in Escondido or whatever the case may be, do they have medical insurance? Do they have health insurance? That's how it starts with you folks? Or are they referred to you? How does that work?
So, the beautiful thing about a community health center is that our doors are open to everyone,
right,
whether you are insured or not. So, our tried and true practice is that we welcome everyone. We don't close the door on anyone. We have what's called a sliding fee scale. So we actually evaluate your ability to pay. And if you're uninsured, then we consider all of your circumstances and find something that's affordable for you. But regardless of, we will not deny you care.
Right. And so, Dr. Russell, is there a one location? Do you have 15 locations? If people want to, get your services, how do they do that?
Yeah. So, good afternoon. We have 14 locations that spread throughout North County, San Diego, from the coastal region of Encinitas, 40 miles inland to Ramona. And then we have one location located in Riverside County in the city of Paris.
Right. So now you started with this organization when, Dr. Russell?
So I had the unique experience of coming to the organization in May of 2020. So I came right at the beginning of the pandemic.
Very good. Right. You just didn't want to go any other way. Just want to make it easy on yourself, correct?
Absolutely.
Yeah. How about you, Michelle?
So interestingly enough, I actually just celebrated my 20-year anniversary with the organization last week. So I started back in 2003 and was appointed by our board as president and CEO in April of 2020. So right as the pandemic was starting to make its presence known.
Right. Sal, any questions?
Well, speaking of the pandemic, I imagine like most healthcare organizations, you face some unique challenges. I take it you're now coming out of those and things are somewhat normalizing?
Yeah, absolutely. I think we've been coming out of it. At the height of the pandemic, at the onset of it, like so many others, there was so much unknown. And we were also struggling with a lack of PPE. And at the time, we had 11 locations. We actually had to close down 8 of them due to a lack of resources and really just, waiting until things had sort of stabilized. Shortly thereafter, Dr. Russell came on and taking the role on as CMO, and it was wonderful to be able to partner with her and really join forces. I had the legacy and sort of the institutional knowledge, and she had the medical expertise. And so together with our chief executive team, we really weathered the pandemic. And so I think we're continuing to come out of it. There's no shortage of challenges, however, and I think we're still sort of waiting to see what the bottom of the pandemic actually looks like. Dr. Russell, I'm sure you have input on that as well.
Yeah, I think one of the things that, in order to be in healthcare that you just absolutely have to have is flexibility. And I think that the pandemic really put that to the forefront. And I think what makes TrueCare so special and what I think is front and center is that we are always patient-centered. And we're also always aware of the support of our staff. And so as we sort of learned our way through the pandemic, right, we never missed a beat. We did have to close 8 health centers, but we stood up telehealth like many organizations practically overnight. So we had providers working from home doing telehealth. We were able to keep the access for our patients. And then as we gained more knowledge and insight as the pandemic, moved on, we were able to flex and create both in-person and telehealth experiences just to meet the needs of the community.
Yeah, right. I'm Drew Schlosberg of Cloudcast Media. You're listening to another edition of Drew Schlosberg's Spotlight on the Community with our good friends from Mission Fed Credit Union. We're in the beautiful Mission Fed Credit Union studio. They've been doing great things for San Diegans for 60 years. Honored to have in the studio with us today Michelle Gonzalez, President and CEO of TrueCare, joined by her colleague, Dr. Marie Russell, Chief Medical Officer and Chief Operations Officer. I'm joined by my co-host today, Sal Giametta, longtime community leader and on the board of the USS Midway. So I'll start with you on this one, Michelle, and you add to it, please, Dr. Russell. You take folks from ages of infant to my age, 105 or something like that, even though I look not quite 105. Talk about the group that you work with.
Sure. And I wouldn't say 105. I think it's like 102.
100. I don't look a day over 102, doggone it. That's right.
A day over 102. So we actually serve every stage and every walk of life. So, we're proud to serve women who are pregnant. We have a very expansive women's health services program, pediatrics, as you would expect, young adults, our adult population, and then also our seniors. So the full spectrum of life, if you will.
Right, exactly. And I know, Dr. Russell, you work in work group with food insecurity. And I know for anybody who's listened to my show over the last 17 years knows that that's still an issue in almost any urban area, especially San Diego is no different. Talk about your outreach, working with groups like the Food Bank and so forth.
Yeah, so the organization has a really robust partnership with many organizations in the community. And so we do regular food distributions in Oceanside and San Marcos. We partner with Feeding San Diego and look for any opportunity. During the pandemic, we upped that and had more frequent food distribution times as well. So we do what we can. We actually are really excited that we brought on last year 3 mobile units as well, and have really started partnerships with organizations like Brother Benno's, St. Andrew's, to really take the care, not only clinical care, but that outreach care, and start to really integrate and partner our outreach efforts with the delivery of clinical care in the community.
Right, again, Sal?
Homelessness is a big issue in San Diego County, as it is across the country. And it's interesting with the numbers that we've seen lately, there's a growing percentage of seniors that are finding themselves without homes. And obviously healthcare is even more of a serious issue as we grow older. There must be some unique issues that population faces. And how do you address that?
Yeah, no, absolutely. So, part of our strategic plan is actually to address the burgeoning senior community. So we entered into a partnership with San Diego PACE, where we are community-based partners. And of course, PACE is the all-inclusive program for the elderly. And what that does as a community-based partner is it allows elders who have been in our care or had a primary care provider at TrueCare for many, many years to stay with that primary care provider, but benefit from all of the services that are offered by PACE. In addition, just last month, we opened a new older adult health center. So recognizing the challenges and the differences that care has for those that are older, and allow us to have a care team that's formed that can really help to address those. And again, also address the social determinants of health that adversely impact our seniors.
When we come back from break, I'm going to talk about you guys are just A1 plus on your collaborative nature, working with all these different groups and feeding, San Diego you're talking about. And I want to talk about your relationship with Uber, and transportation and so forth. I know Sal's going to have some, questions on that. I want to really dig deep into the mobile fleet that you have, which is so critical, getting to the people that need you when they can't get to you. No wonder you've been doing great things since 1971. When we return with Michelle Gonzalez, President and CEO of TrueCare, joined by her colleague, Dr. Marie Russell, Chief Medical Officer. I'm Drew Schlosberg. As you're listening to another edition of Drew Schlosberg Spotlight on the Community Show on the Cloudcast Media with Mission Fed Credit Union, and I am honored to be joined by my co-host, Sal Giametta. We will be right back.
When you do your banking with Mission Fed, you get great rates on auto and home loans. That's good for you, but something good also happens for a lot of other people. We're not for profit, so we put money back into the community to help lots of great nonprofits to keep San Diego strong. So you're not just getting something good, you're doing something good. Come to Mission Fed. It's banking that's good for all.
Brand amplification is the DNA of Cloudcast Media, and our code is the powerful blending of sound, voice, and storytelling to lift local brands and their communities. Whether it is our Brandcast, Schoolcast, or Causecast platforms, the unifying ethos is all about this community, the one you call home. If you dare to dream and want to explore the brand amplification of Cloudcast, a national leader in local podcasting and other Winfluence strategies, please visit us at cloudcast.us.
I'm Drew Schlosberg, Cloudcast Media, and you're listening to another edition of Drew Schlosberg Spotlight on the Community Show, brought to you by Mission Fed Credit Union, and doing wonderful things in our region for more than 60 years. We are joined by our friends from TrueCare, Michelle Gonzalez, President and CEO, and the Chief Medical Officer and Chief Operations Officer, Dr. Marie Russell. My co-host with me is Sal Giametta, a longtime friend of mine and a community leader, now on the board of the USS Midway Museum. Right before break, we were just talking about the collaborative nature of you folks. You guys have so many different connections on this. I'll start with you on this, and Michelle, and you can jump right into Dr. Russell. Talk about your partnership with Uber.
So we're really proud of this partnership. We recognize, there are so many barriers that interfere with our patients' ability to access care and services, and one that's right up there at the top is transportation. And so we recently partnered up with Uber Health to make sure that our patients who don't have the means to get to their appointments can get there free and clear, and it's a direct shot. And this really obviously helps to enhance not only their experience, but can make sure that they can adhere to the care plans that are laid out by their providers.
And I think what's so interesting about that, and I'm sure you've heard this before, Sal, and we work with groups like Miracle Babies, who are just spectacular, Dr. D, Sean Donishwan, and they provide transportation because one of the things that I'm sure, Dr. Russell, is, yes, you got the appointment, but you don't know how to get here, and you can't get here, and you can't miss this critical appointment, whether it's curing something maybe is like cancer or whatever the case may be. Talk about how important it is to make sure that these folks are getting to their appointment or you're getting to them.
Yeah, no, it is imperative. And I think, both for preventive care as well as acute care. So oftentimes, we're trying to establish people with primary care providers and move away from that episodic care, which just fragments their health, to be quite honest. And so, as a community health center, a lot of our population, their own health may not be the primary thing that they're concerned with that day. You have moms who are concerned with their kids, that are concerned with their parents. And so putting that emphasis on taking care of yourself. And so in order to do that, you do have to show up. But TrueCare really does everything that we can possibly do to make it as easy as possible, with a real focus on access. So, we have, you can make a call, you can make an appointment by walking in, you can make an appointment now online, you can make an appointment through the phone. So we try to do as much as we can to improve the access and really just be there for the patient.
And it's so critical, Sal.
Drew's covered a number of your collaborations, and I'm really impressed with how extensive they are. Is this, Michelle, part of the organization's strategic plan? Is it because there's so much need in the community that you're constantly being approached? Is it a combination of both? How does that work?
It's all of the above. As a community health center, we can't do everything, right? We recognize, as you were speaking to, Drew, having needed coverage, for example, being enrolled into a health, into insurance, be it Medi-Cal or private, that's only part of the process. You also have to know how to navigate healthcare. And we really have sort of a no wrong door approach. So that's why it's critical that we collaborate with as many community partners as possible to make sure that we're getting the message out and people understand how critical their health is. There are too many barriers that they're facing. Oftentimes, our patients will have to choose between filling a medical prescription or buying food for their family. That shouldn't be a choice. Healthcare is a right. It's not a privilege. And so by collaborating with community partners like Uber Health, Feeding San Diego, Brother Benno, San Diego Rescue Mission, our local schools, Lifeline, other community-based organizations like that. That's the only way that we're going to continue to be able to come together and lift up our communities as a whole.
And you hit the magic word, and that is community and collaboration. And you're absolutely right. There's so many tentacles and spokes to this. And when there's connected like this, good things happen. I cannot wait to chat with Dr. Russell about the baby boom tsunami. We'll talk about that.
Well, yeah. So as we talked about, right, we know that there are a burgeoning number of folks who are going to be turning 65 and older. And again, fortunately in this country, people are also living longer, right?
Exactly.
And people are also functioning longer, right? So their quality of life is longer. We know people are not able to retire perhaps as early as they had previously due to challenges within the economy. So all of that paints a really unique and dynamic challenge for healthcare as we are trying to address sort of the increasing numbers of older folks. But again, healthcare is at the end of the day about that quality of life and about functionality. And so trying to create programs through partnerships and through the services that we're able to deliver on site to be able to meet those demands.
And the statistics are startling.
Right.
In the U.S. alone, there are more than 10,000 individuals every day who are turning age 65. And here in San Diego, we're looking at an increase of about 60% in our senior population by 2035. So partnering with the community, really pulling all of these resources together is the only way that we're going to be able to serve this population.
Yeah. I'll let you guys know in 20 years when I hit that number. But I went from 102 to 45 in the span of about 12 minutes on this aspect. But in all seriousness, you're spot on, both of you, on that. I'm Drew Schlosberg, Spotlight on the Community Show here at Mission Fed Credit Union, talking to our good friends at TrueCare. Michelle Gonzalez, President and CEO of the organization, joined by Chief Medical Officer and Chief Operations Officer, Dr. Marie Russell, joined by my colleague and co-host today, Sal Giametta. So I'll start with you on this, Dr. Russell, and then pivot over to you, Michelle. We always save this time in the show for what our listeners can do to support your efforts.
Yeah. So one thing I just want to highlight that I think is, Michelle had referenced, right? So one thing that we focus a lot about is just gaining resources for our patients and supporting our patients. And one of those is through through enrollment through Medicaid. So as the public health emergency ends, we are looking at within, millions of people falling off Medicaid in the state of California, and upwards somewhere between 13 to 20%. And so one of the things that, we can all be aware of is encouraging folks, right, that may be on Medicaid, that they need to re-enroll where they hadn't been forced to re-enroll over the past 3 years, because we want to make sure that they are accessible to all those resources.
Absolutely. Michelle?
Absolutely. I think building on that, I would say just continuing to get the word out about not just TrueCare, but the need to access medical care in general. We really embrace this philosophy that there is no wrong door. And so much of healthcare happens outside of the four walls. As we've talked about, a lot of it is based on your social circumstances. And we look to a lot of our community partners to be able to tackle those issues. And so our goal is really to make sure that we can promote the need for preventative care. We can, interrupt a lot of really tragic outcomes if we can assure that people are getting in ahead of time. We can keep folks out of the ER, and ultimately we can save our system millions of dollars. 1 in every 5 Californians receives their health care at a community health center. And so we're really proud to be able to do that, and would say just continue to refer folks over to TrueCare. Let's get them in wherever they need to be placed, wherever they're at in their on the spectrum and in their walk of life.
How do they get a hold of you? What's the website?
So really easy, truecare.org, and you'll find us there. And as Dr. Russell said, we can help you get an appointment online, via phone, and also feel free to walk into any of our clinics.
No, that's great. Sal, any final comments?
I'm just so impressed with what TrueCare is all about, what you do. Thank you for your service to the community. Thank you for collaborating and partnering with all of the folks out there that help you do the best you can to serve the community.
Yeah, and we're just getting started with you folks. You've already made a promise to me at the break that you're going to come back on, right? And hopefully multiple times. In all seriousness, bring in some folks that have benefited from you, or bring in your partners. You cannot talk enough about the services that you offer. And one of the things that frustrates me, and I think Sal too, is when someone says, "God, I wish I would have heard about this before." And now I know about it, and that aspect of it. What an honor to chat with both of you folks. And Sal, thanks for joining me. I know you're going to stick around for some other interviews. I hope you have time to do that, as we've been finishing our conversation with Michelle Gonzalez, President and CEO of TrueCare, joined by her colleague, Dr. Marie Russell, Chief Medical Officer and Chief Operations Officer. I'm Drew Schlosberg. As you've been listening to another edition of Spotlight on the Community on Cloudcast Media, brought to you by Mission Fed Credit Union, doing wonderful things in our region for 60 years. We hope you enjoyed the show.
You've been listening to an episode of Drew Schlosberg's Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego community. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
Cloudcast Media.